Thank you. Good morning. Don't worry about time. The only thing is that you won't have the same time for lunch. Okay, now let's continue with our agenda. I would like to invite Professor Henry Cohen as a moderator, and he is a gastroenterology professor, general secretary of the National Academy of Medicine, master in the American gastroenterology, and he's also president of the World Gastroenterology of Colonization. Thank you, doctor. Good morning. It's a pleasure to be here with you. Thank you for the invitation to the President, Vice President, and the company BioCodex. Well, it is an honor to present my old friend, Dr. BUSTOS first. Congratulations for his birthday. Happy birthday. I won't tell how old is he, but congratulations. Happy birthday to you. And I could tell you that the following presentation, it will be a very interesting presentation too, and it's a challenge. So we can consider what's your experience about the evolution of human microbiota from birth to adulthood. Luis has all this knowledge. He has a lot of experience in this topic, and he's also participated in different scientific societies, and he was the last president of the Gastroenterology Society and is the current president of the Latin American Association of Neurogastroenterology. Let's welcome Dr. Luis BUSTOS. Good morning, everybody. And it's a true honor to participate in this scenario with other speakers, to be here and give a presentation after Dr. Werner. I need to include it in my CV. So, it's very interesting to have a story. This could be like telling a story because we would like to see these ingredients to baby and bacteria, trying to see how can we try to join them so we can start making this story throughout microbiota, throughout the symbiosis we have in our gut, and throughout all our knowledge of metagenome, where they are joining bacteria with a host, and we start forming this that could be called like a superorganism that, as the theory of Gestalt says, that the whole is more than the sum of all things, and the superorganism that we have is a microbiome. As we were saying, in life, we start to have different elements that interact, like diet, the different inflammation processes, the environment, the presence of cyanometabolites, and of also the different types of the individual phenotype. And each person will have his own individual, in particular, microbiota, from symbiosis or dysbiosis and the possibility of the presence of intestinal diseases. So throughout different life stages, we find a first stage that it's an unstable stage, and as we have mentioned before, most of the attendees are pediatricians and have a lot of relationship with this unstable stage, but something's happening, and I think we haven't recognized microbiota in the elderly stage, and as we treat adult patients, it has to do with it, and it has a lot to do with the clinical elements and the stable situation that goes in the healthy adult patient. And this would be like a fingerprint where each individuals have a particular microbiota characteristic. Now, let's try to follow this story. We have this relationship that it's between the mother and the child, and historically we stated that during birth of this newborn was sterile, completely sterile. And this is a doubt that has been solved because we were only stating the presence of bacteria in the amniotic fluid causes infections, and we were linking this to specific microbiota. But we have started to see throughout different and recent research studies that we have microorganisms present in placenta, in the amniotic fluid, umbilical cord, and meconium. So it might seem that microbiota, specific for the newborn, was previously forming inside the uterus. So, beyond that, what comes inside the uterus at birth, the child is colonized by bacteria originating mostly from the environment and the mother. And throughout this, we will be able to find this type of ecosystem, the goat ecosystem. This is a continuous process affected by endogenous and exogenous factors and goes throughout different life stages. So there are different factors that are influencing the mother, and there are others that will influence the child's gut microbiota. Now, from the mother, we have what is going through pregnancy, weight changes during pregnancy, exposure to antibiotics, different social and hygiene conditions, high-fat breast milk, bacteria in the amniotic fluid that we have mentioned before, smoking during pregnancy, gestational metabolic abnormalities. Now, in the child, we have different elements that add intensive care at birth, if the child had different problems, exposure to antibiotics, birth weight, gestational period, and there is a mother-child symbiosis. Now, colonization in the newborn depends on two main factors. That is, to depend the type of food the infant receives, breast or formula milk, duration of breastfeeding and weaning, and other factors that could be woman's genital tract microbiota, if it was vaginal or Caesarean delivery, sanitary conditions, and type of nutrition. So, when we have a vaginal delivery, microbiota starts to join between the microbiota from the mother that is highly differentiated with a non-specialized microbiota from the newborn. And the presence not only for the gut microbiota, but also the vaginal microbiota, that it's mainly lactobacilli, and the mother starts to have Escherichia coli, Klebsiella, and other type of bacteria. So this starts to produce, that is a symbiosis from what is related between the mother and the newborn when we have a vaginal delivery. Now, when we have a Caesarean delivery, there are other factors. Newborns have a microbiota that is not necessarily induced by the mother. We have skin ecosystems, and also health workers are involved there with different people, like the surgical instruments, and interaction with the environment starts to cause the newborn different ecosystems with a strong environmental feature. Now, from the symbiotic relationship between the mother and the child, different factors start to arise in the C-section. That are certain elements that will create a different microbiota. So we have the vaginal delivery or Caesarean delivery with different types of bacteria. What happens in the hospital ward? What happens with the hygiene measurements and also diet that could be balanced or unbalanced diet? And this is a very important factor. And we know in our countries, having breast milk or formula milk, and you as pediatricians also know this, that is fundamental in these places where diet is so important, and also formula milk compared to breast milk will be a different feeding method, and this is joined to shape the modulation of the gut microbiota. So, as Francisco mentioned before, we have this microbiota from actinobacteria, proteobacteria, firmicutes, and bacteroidetes that have different concentrations when we're talking about these different elements that participated in the delivery type and nutritional type. Now, the physiological programming of the gut microbiota is stated in different stages from 0 to 18 years, where we have infancy, we have breast or formula milk, and the delivery type, that is symbiosis with the mother. And as the child starts to grow, we have a modification, weaning and switching to solid food from 1 to 6 years old, childhood and adolescence, and starting to 18 or 19 years, then we start to have this stable stage in microbiota, not as unstable as it was in the previous stages. And we have this type of communication between gut microbiota and the host, the child, with the different types of elements that could participate in different diseases like metabolic diseases, energy storage, immune function, gut barrier integrity that is so important, the autonomic nervous system, and host processes, as we mentioned, by the proliferation of epithelial cells, intestinal motility. So we start to form throughout this unstable state. They're trying to find stability that is achieved in adolescence. Now, what happens in adulthood? We have the maximum microbiota complexity, as we said before. There is a gradual increase in phylogenetic diversity during adulthood, and we have seen that this is very important, that it's diversity. And it also has to do with the different places around the world, the different types of microbiota, and we start to form this stability, as we mentioned before, throughout diversity. And then it helps to form the immune system and preserve human health. And there is a key element, that is the production of vitamins, digestion, energy, homeostasis, and angiogenesis, and the preservation of the gut barrier integrity. Now, there are alterations that could happen in our adult patients, and if we have Maradona's image has changed so many times, and maybe it has to do with his microbiota. It might be, even though he has added additional elements besides microbiota, but we have alterations due to different medical conditions, inflammatory bowel disease, irritable bowel syndromes, antibiotic response, and it depends on the individual and is influenced by prior exposure to any type of antibiotics. And we will try to find this adult-type gut microbiota, trying to preserve this homeostasis in the absence of significant ecological stressors. So, as we mentioned before, bacteria and firmicutes represent 90% of adult human microbiota, and then we have proteobacteria and actinobacteria mainly, that, as I said, it's a search from childhood. They're trying to find stability with this microbiota. Now, what happens in old age if we continue? Here, in old age, there is a fundamental element that is participating, that is the decrease of the immune system function, and the individual is susceptible to common infections, and it has external factors that are influencing it, and we have like poor nutrition, taste and smell disorders, difficulty with chewing and swallowing. All these are factors participating in the relationship between the adult and the diet. It's completely different to the childhood. Nutritional diet is unbalanced. We start to have atrophic gastritis, absorption of calcium, vitamin B12, and also alterations in motility and modifications in bacterial fermentation. So, in elderly people, we start to understand a word that is the inflammogenic state, that is a lack of balance from pre-inflammatory stage, and we start to have this word that for the ones working in the digestive functional pathology, we like to hear this, that is a low-grade inflammation. They start to explain certain physiopathological elements that are differentiated from the image of the inflammation and inflammatory diseases. And This is a lack of balance between the pre-inflammatory and anti-inflammatory state with the inflammogenic state. That is a decreased activation of TMB lymphocytes, inadequate generation of new lymphocytes, and decreased activity of killer cells. That is an increase of pro-inflammatory cytokines. We start to have diseases that are present in adulthood that are related to the presence of microbiota alterations like cancer, Alzheimer's disease, arteriosclerosis, osteoarthritis, and insulin resistance. And obviously, other metabolic diseases that are related to the same thing, diabetes, obesity, and others. And the metabolic syndrome, that is another fundamental element within adult diseases that are related, closely related to the presence of microbiota. So, elderly people produce a presence of high level of intestinal gut microbiota, and we start to have problems with food, and then we can have problems because we are talking about the presence of high levels of firmicutes and bacteroidetes. There is a high proportion of bacteroidetes and reduced stability of the microbiome. There is a significant reduction of diversity from what we've mentioned before, and the stable period of adulthood has to do with diversity. It significantly decreases. There's a reduction in beneficial microorganisms and an increase in facultative and aerobic bacteria. There is a greater susceptibility to infection, mainly Clostridium difficile. So this starts to relate to microbiota, and it happens in adulthood. So what do we have to do? Then we need to stay 3 stages. Number one, we need to define what could be healthy microbiota in early and old age, health, breast milk, vaginal delivery at term, or preterm delivery with a cesarean section, formula milk, and healthy adult, the elderly person. It's a balance we try to have here. Now, for the second stage would be to identify objectives for the intervention. What we would like to modify in the intestinal, microbiological, immune system, integrity of the epithelial barrier. Now, extraintestinal elements, and we will talk about in the afternoon of the relationship between the cerebral intestinal access, cognition, endocrine function, nutrition, identification of objectives for intervention. And trying to find this functional improvement, we need to try to consider intervention that would be through prebiotics in a diet, probiotics, and functional food. So I'd like to finish my presentation with an interesting slide. And the student says, "Sir, the questions in this year's final exam are the same as last year." And the teacher says that maybe you recognize this. Teacher says, "Yeah, the questions are the same, but the answers have changed." So we need to think again that maybe next year we get together, and as Francisco said before, we are in the Stone Age, and maybe what we say today could be changed for the next year. But the mind needs to be open, trying to extend and have any conclusion. Thank you very much. Thank you, Luis. Great presentation, wonderful presentation, and you didn't distract a lot as you are older. Yeah, I'm 33 years old. I don't know if 33 or 28 years old. I don't remember my age. Yeah, you have a well-integrated brain. Questions for a speaker? My name is Fernando Medina. He's a very good friend. Excellent presentation. I would like to talk about colonization of the bacterial flora of microbiota in children. Yes, I understood the concept, and we are colonized during delivery, in the vaginal delivery, Caesarean delivery. But as we mentioned last night, colonization is minor. Yeah, there is a colonization, but it is not of a great amount. And the most important source of colonization is breast milk, where we have like 800 cubic centimeters to 10 to 14 milliliters every 3 hours. We have breast milk. So we have a question on where gut flora comes from the mother to the baby. And the answer is very simple. Like 6 or 7 years ago, we discovered that the gut flora from breast milk comes from microbiota from the mother, and it's an inter-mother way. It has a very long way, and it goes through different ways, and it goes through live cells in the intestinal lumen. And we have found that almost 700 species of microbiota goes in our gut. It goes through the respiratory system, tears, and then it goes to the breast milk, and there is where it starts to colonize the cecum of the baby. So that's the way colonization is done. Very interesting comment from a well-known specialist. Any other question or comment? I have a question, but it's a difficult one. I'm ready. I'm a gastroenterologist with adult patients, but we have heard a lot of necrotizing enterocolitis in children with Caesarean delivery, that probiotics could be effective for treating these patients or even to prevent it. And we know, as you mentioned before, in adult patients, we also have different diseases and problems that could be related to probiotics like Alzheimer. But in the digestive part, that's my field, we have situations like a decrease in the blood circulation that has mesenteric problems. What is the relationship in the decrease in the microbiome and the gut? Or we could ask Pancho. Okay. We could think about any specific experience, and Francisco's experience could be good, that ischemia and permeability, I think they are closely related, and the modifications that could arise and the different models of the disease, inflammatory disease, or the damage that could go in anastomosis, kidney anastomosis, surgeries. Juan Tutabala has worked a lot in this topic. And there is a clear alteration of the gut permeability, and the relationship with microbiota should be different with patients with ischemia. Francisco, would you like to add something? It seems that gut permeability is not affecting the colon because it has a very thick wall with a high size, with a big size bacteria, even if we have specific situations. But the big problem is small intestine, where we will be able to understand the inflammation in the small bowel. I think this is a topic for the symposium we're having this afternoon. Thank you very much for these very good presentations. Thank you very much to our two speakers. And I'm sure the topics we're having this afternoon will be very interesting too, because Dr. Warner, I think the break of the epithelial wall, that it's very interesting. There's not a mechanical action. It's influencing when they're sending messages, and it goes to the central nervous system. But we will talk about that in the brain cut axis.